very much. I'm glad to be with you all here today. I'm going to talk about, just in general, this movement of nature prescriptions, such as NaturePHL. And then we will move into some information about the program. Elisa will give you details, and then we'll talk about some of the research and evaluation that has and will be going on around this program and others. So first of all, this is a graphic from the website of the National ParkRx Initiative. And indeed, park prescription programs are everywhere, and their numbers are increasing. The initiative estimates, in fact, they just conducted a survey, or a census, I guess, of these types of programs, and there are between 75 and 100 park prescription programs across the U.S. Many of them share very similar structures and objectives. For children's programs, pediatricians often will prescribe patients time and green space, and sometimes it comes along with a recommendation about what type of activities to do, and they might provide education and reasons why. So in some cases, patients might be referred to a specific park or a specific formal program, and some of them use incentives of various kinds. We'll give you more details when talking about NaturePHL. I do want to step back a little bit. So while it feels like these nature prescription programs are new, they actually are not. And the most recent, I guess, emergence of this type of approach, healthcare approach, I would say came around the late 19th and early 20th centuries in response to intense industrialization in cities, poor housing conditions, and resulting medical problems, especially for children. So there were things like country leaks and fresh air funds, playgrounds, preventatoriums, open-air schools, or marine hospitals that serve children from industrial cities across the U.S. But the programs had a wide range of objectives, so, from providing a safe place to play to treating sick infants and children. And so my colleague Maggie Cernick and I have written a paper just exploring the history of this movement, and you can see the citation below. The journal is American Journal of Public Health, and you can find it on my website. So the photos you can see here and the next slide are of the Children's Seashore House, which is the ancestor of the Children's Hospital of Philadelphia, or CHOP. So this is one example of this type of institution. It was opened by a philanthropic group in 1872. The hospital provided, not just for the sick kids, but for the mothers and siblings and, families of kids, just as a way to get out of the city. So despite their widespread popularity, however, nature-based therapeutic programs really faded from medical practice over the 20th century, and due to many things, in part due to advances in technology. So patients could now swallow their vitamin D, as well as in general, less emphasis on the role of the environment in promoting good health, and more emphasis on advancing medicine and medication to treat disease. So, current day programs are responding to similar health issues faced by especially urban and urbanized populations. So you've probably heard of this term, nature deficit disorder, but it is very common. We have increasingly sedentary lifestyles, which is leading to increased rates of chronic disease among children and adults alike. And the statistics are really not good in Philadelphia, especially, likely due to high rates of poverty throughout the city. So people are just not getting outside and moving, and our bodies are suffering. But there is an increasing amount of evidence that the more time we spend outside in nature, and the better our health. So this is true when we're talking about mortality rates and premature death just in general, but also specifically about our mental health, our attention, anxiety, and stress, as well as mood. And I think there is a there's good, strong evidence for many of these health outcomes, especially among adults. I'd say there is definitely room for more and improved research when talking concerning children. Thanks, Elisa. And I seem to have lost connection to Adobe Connect. Would you mind advancing my slides for me? I'll just say next.
Sure, I will do that.
Thanks. Okay, so there are many research questions that surround NaturePHL and similar programs. We want to know and we want to support via research these types of programs, and we want to see them being successful in connecting people, individuals, residents, and families and communities with their local, regional, national green spaces and natural amenities. And so, we start with, first of all, what the role of the physician or the provider, what does it take to get them to participate in a program like this? As we know, providers just don't have a lot of time, when when interacting with patients, and there are usually so many other issues that fill up that time with them in the office. And so, what does it take to get providers to participate in programs like this? And then, of course, what does it take to get families to actually spend time outdoors together or on their own? And does it take certain incentives, resources, or information? Is it new types of programming that they need in local parks? What are barriers and what are facilitators to connecting them and actually getting them to go and spend time outdoors? How about the role of the caseworker or the Nature Navigator, as it's called with the NaturePHL program? Can some, a role such as that have an influence on participation, patient participation? And how so? And what is the best mode of operation for someone in that role with different population groups? Next slide. So how about what sort of short-term impacts then do nature prescriptions have on patient and family health? And research that, there are all sorts of, as we saw in the slide earlier in this presentation, there are so many different aspects of health that are affected by our environments and the time that we spend outdoors. But I and my colleagues here tend to focus on stress as a sort of a short-term physiological response to urban environment, to our environments that can affect other areas of health, as well as physical activity, sort of another mechanism by which our environments can affect our health, and positive sort of green vegetated environments. But there are many more. And then how about long-term health impacts of nature prescriptions for both patients and families, and as well as on physicians taking part in programs like this? Next slide. So there's a lot of text here, but I just wanted to tell you that there is a growing number of studies on asking and addressing this type of question, and my colleagues and I have conducted a systematic review of the literature and found just really only a couple of handfuls of studies on this type of program. And so we are and will be looking for more evidence in this area, and we are trying to build and contribute to this area of research. Next slide. So we have conducted, some preliminary research. We first wanted to know about, what are the barriers to access for patients accessing local green space, and what are their perceptions of a nature prescription? What would they think if a doctor told them to spend more time outside? And we answered this question by conducting focus groups with residents living near the CHOP clinics where the prescription is given. And we found and learned, and actually this, I don't list this here, but our findings are published, and you can find those on my website again. But we found in Philadelphia that major barriers, as we might suspect, are fear of crime and concerns about safety. And so this definitely needs to be part and incorporated into any counseling that is given, and any tools and instruments that are used, either in a general, more universal prescription, as well as by the Nature Navigators. And so this is really, I think, a big question for us and for many others. And then next slide. So looking at or trying to assess the short-term health impacts, we conducted a pilot study where we asked parent-child pairs to wear Fitbits and location tracking apps. We installed apps on their phones so that we could know where they were, and then tie their biometric data about their sleep, their heart rate, and their activity level to their location. And we could tell when and if they were in a park or green space or not. And so that way we can compare and look at some of these short-term responses to exposure to parks and green spaces, and we would like to be able to scale this up. Next slide. And then I also want to say that we have planned a survey to roll out here soon, where we will ask patients both before and after they receive a nature prescription about their habits, their attitudes, and behaviors around going outdoors, as well as a survey of providers about their goals and their barriers to participation in the NaturePHL program in particular. Next slide. So there's a lot more, and we love to hear more about what are the questions that we should be exploring, and would look for that in feedback. So thanks for your attention.